That's actually one of those great things that we touched upon earlier, where you can see that immediate change in people. You can come with somebody who's not happy with their smile for whatever the reason. And believe it or not, a lot of people that have veneers have pretty decent smiles to begin with. They just want to take it to the next level. A lot of times people that come in with a really bad smile, their mindset isn't set on veneers. A lot of it's getting set on healthy first. From our point of view, we really slow things down. You know, if you look at it from a business perspective, it's actually not a good thing. But we slow things down because everybody's idea of beauty is different. You and I may look at a house and I'd be like, wow, that's a really beautiful house. And you may look at that house and go, well, that's okay, right? It's not what pleases you. Everybody's idea of beauty is different. A lot of dentists wind up going straight from veneers to the final product. Okay, this is what's best for you. Well, how is it my job to tell me what's best for you? And I tell patients all the time, it's my job to make sure they fit. It's my job to make sure they function. It's your job to make sure you like the way they look. And people will surprise you. So we actually add extra steps between the day of preparation and temporization. I always make patients come back a week or two later, and we're gonna sit down and we're gonna critique your veneers. I was hoping they'd be a little rounder. I'd hoping they'd be a little more flat. I would hoping the embrasures between the teeth would be a little more pointy or a little more flat. I would hope they'd be a little wider. I think it's a little more too bulbous here and it's a little too flat here. Is that a wasted appointment? Yes and no. Your business manager will tell you that it's a wasted appointment, but the patients, I don't ever want a patient to look back saying, I think we could have done better. So we will break down that step of, I don't care how many times I have to see somebody, and people can tell you, I want bigger, whiter, straighter teeth. Okay, great, what does that mean? Until you physically see it in your mouth and you go, that's it, right? So we'll bring people back from preparation to cementation of veneers. We'll bring people back as many times as it takes until they look at their temporaries and they say, that's the look I want. That's what's been in the back of my head the whole time. And sometimes it takes 2, 3, 4 appointments to pull that out of patients to make sure they're getting exactly what they're looking for.